Hey everybody, this is Dr. Anthony Barta at Brown Chiropractic and Needed Healing. It's back to school time, which means that student athletics are starting up, and what we start seeing in our office is injuries due to those school sports. So one injury that we see a lot of is shin splints. Now that's just when the athlete is going to have pain on the front part of their lower leg here on their shin. They'll usually feel it mostly when playing the activity or running. Now they could have pain over here on the outside or on the inside. This side is usually more common, but you can get it either side there. Now this is caused usually by any number of things, from the wrong type of footwear. It could be how they're running, biomechanical issues, switching surfaces, going from, let's say, running on grass to running on a hard floor or something like that, or just straight up overuse of that area. So what's happening here down on the lower part of the leg, if it's on the inside, you have muscles that attach right here to this bone. Those muscles can be getting pulled tight from how your foot is moving and landing, and repeated stress to those muscles is just pulling on that bone and irritating it. Now on the other side, it's just going to be straight muscle pain. It could be micro tears in that muscle, again, just overuse and increased tightness in those muscles right there. So what we like to do in office is first just make sure that all the joints are moving and working how they should be properly. We might do a gait analysis to see how the athlete's moving, and then we'd also just make sure that, like I said, the foot, ankle, knee, and hip all the way up into the low back, everything is working how it should be, and adjust as necessary. Then we can also use the A-stem, as we've gone over before. That's a great tool to help loosen up tight tissues, help break up scar tissue and adhesions, and get those muscles functioning properly again. And then for relief while they're doing whatever sport they're doing, we like to use some rock tape or kinesia tape. We would tape up the area of their complaint where they're having pain, and that's just going to provide some decompression over the area, as well as a little bit of stability there for that area, and give them some relief while they're playing. So and then at home, you just want to stick with some ice, and then some stretches and strengthening exercises. So the ice is just going to be 15 to 20 minutes at a time. Place it on the area of complaint. That's just going to help deal with any inflammation, swelling associated with the issue. And then finally, we're going to show you a couple stretches here, just 2 stretches to help loosen up those muscles down there. So you're going to find yourself a wall or a counter or something to push off of. You're going to stick one leg back, that's the leg you're stretching, and you're just going to keep your toe pointed forward, not out, not in. You want to keep it forward. Keep your heel down on the ground, and then you're just going to lean into it and push on the wall. And you're just stretching your calf right there. From right there, you can just drop your knee down a little bit like that. You might want to come a little more upright like that, and you're just dropping your knee down, really kind of pushing your foot or pushing your knee down actively while keeping that heel down. You don't want to be doing this. Keep the heel down. And then the last stretch here, I think I said we were doing 2, we're doing 3. So just gonna get down on your knees like this, poised, toes pointed backward, and you're just gonna sit down on your heels like that. You're gonna feel a nice stretch on the front of your shin right there, especially if it's irritated. If you're not feeling right there, you might need to actually come up, and you're just gonna point your toe while you kind of push your toe into the ground. This one's a little more awkward, but you are gonna get a nice stretch on the front of your shin right there. Now, shin splints can be confused or misdiagnosed with a couple other issues, so you do want to make sure that if you're having this type of issue, you're getting it checked out and properly diagnosed, so then you can begin the proper rehab or possibly other intervention to heal properly. If you have any questions about shin splints or anything else we went over today, just leave a comment below, or you can give us a call or come see us in office at Brown Chiropractic and Needed Healing. We'll see you guys in the next video.